Now let's talk about how we test. It's actually quite simple. Your brain is basically the mainframe computer. It's what's interpreting everything. So if you have an allergy to, say, dogs or cats, I can be around dogs and cats and I'm totally fine. Dogs and cats, there's nothing wrong with them. But if you're reacting to them, it's not that dogs and cats are bad for you, it's just that your brain thinks they are. So we just got to retrain the brain, which is, what people do all day long when they're, training for musical instruments or sports, foreign languages, different languages. That's retraining the brain. Well, we're going to do that too. We got to do that immediately, basically. But we did learn that we can't do too much too fast at once because it is overwhelming and exhausting, if you will, to the brain, so it can't retain the information. So I know what that magical level is, that safe level, because I've been doing thousands and thousands of patients with this for, like I said, since '05. So how we test is basically what we're going to do is we're going to send out the signals through the box here. It's going to come out through radio waves. And remember, the brain's the interpreter. So what we're going to do is we're going to do what's called muscle testing, or MRT, muscle response testing, applied kinesiology, another name for it. So basically what we're going to do is we're going to check your strength of your deltoid muscle. And then if you're strong, then we know that, okay, everything's working great because your brain's focused on your deltoid muscle to resist me or my technician. Well, if you go weak, so let's say I send out the signal our number one food is grains. Number one, grains, gluten, right? Wheats, oats, barleys, brans. So if I send that out and you're holding the box, your brain thinks it's touching grains. So now your brain says, if I'm trying to push on your arm and you're trying to resist me, your brain says, oh, I got to fight the grains in the box, and I also got to fight Dr. Foster pushing on my arm. So it doesn't fire all your muscle fibers, no matter how strong and how big you are. I've done professional bodybuilders, NFL players, very strong people. But when they hold something their body doesn't like, they cannot hold my arm up, where otherwise they could hold it up no matter how hard I try. So they go weak, you would go weak, and then we know we have a sensitivity. So that's what we want to find is sensitivities. And the bottom line with everything I do when we do muscle testing is we need to find any weakness that your body has and strengthen that weakness, whether it's through allergies and sensitivities, or maybe it's nutrition to fix different organs or tissues or infections. But we're not going to just play guessing games, because that's what, unfortunately a lot of doctors do, is play guessing games, and sometimes they're good guessing games. And we can use labs in conjunction with this, of course, as well to help narrow things down. But ultimately, if you muscle test something, you're going to find either the body wants it or not. That doesn't, always mean it's the only thing, but that's definitely what we got to fix. So bottom line is, when we treat you, we're going to expose you to that signal through testing, and then we'll go into treatment in the next video. But what we want to do is turn what is weak into something strong. So then when your brain is around grains again, or eats it, I should say, or dogs and cats, whatever you have, when your brain is exposed to it, it doesn't think it's an invader and fighting it anymore. It just saying, so I'm fine. Doesn't matter how severe you were. Anaphylactic is another topic we won't discuss right now, but overall it doesn't matter if it causes brain fog or digestive issues or focus issues or ADHD or bloat or gas or diarrhea. It doesn't matter what it causes. I know we're always looking for that answer, that miracle answer, but bottom line is, if we just strengthen your body to the things you're eating on a daily basis, you're going to find a dramatic improvement in your overall health and wellness. So let's talk about how we treat in the next video.